The following segment is sponsored by Intermountain Healthcare.
Well, we have Dr. Margaret Van Meter here. She's with Intermountain Medical Center. She's an oncologist there to talk about mammograms. It's Breast Cancer Awareness Month, and every once in a while, a person gets a call back saying, hey, you need to come back, we need to take another look. What does that mean when you do get a call back?
Right. Well, that's obviously a scary moment for many women.
It might be nothing.
Right, exactly. And that's the important thing. It may not actually be a cancer, and it's important to go. There can be other things that show up on a mammogram that just we don't get the best view of the first time. We need to take some additional views and maybe do an ultrasound to get a better sense of what's going on there.
It might be a cyst that has liquid in it. I mean, I've learned a lot about what, what it could be, but it's still scary.
Right. It's very scary. It's very scary.
Okay, so they do an ultrasound. That gives it a closer look.
They do often some additional views on mammogram and sometimes an ultrasound.
And then a biopsy might be needed.
Right. If something still looks concerning, then a biopsy would be recommended at that point.
Okay.
Oftentimes that's done in the radiology suite, using a mammogram or using an ultrasound to direct them for the most appropriate place to take that biopsy.
Okay, and I know mine was all in the same room.
Right, exactly. And that's usually the way we try to do it. Sometimes it can be more difficult from a technical perspective.
Okay, and the biopsy is a tiny little harpoon, and that's exactly what it feels like, by the way. And then once you are diagnosed, there's a whole team of doctors to help you through.
So that's very important, is you are not going to be alone in this journey as you experienced.
And luckily everybody specializes, and they're all good in their own fields.
Right, so we will put together a team of experts that are specialized in breast cancer treatment that will often include a surgeon, a radiation oncologist, medical oncologist, genetic counselor, nurse navigators. We have a team that will help guide you through the most appropriate treatment for you.
And they all get together and look at the same case and say, okay, I think this, I think this, I think I do this, and you come together, and then you weigh in too and say, I'd kind of like to do this.
Right. We bring a medical recommendation to you, but we also really want to hear from you and your preferences, priorities, you know, your general health. All that is taken into consideration when coming up with a final treatment plan.
Okay. Well, thank you so much for coming in. Some great information. If you ever have any questions about your health like this, you can go to our website, KUTV.com, and click on Check Your Health. We'll take good care of you.